to Tennessee This Week. I'm Blake Stevens. Well, Knox County set to enter phase 2 of reopening on Tuesday. I spoke to Knox County Mayor Glenn Jacobs and City Mayor Indya Kinccannon about the potential impact of this milestone and what it will take to reopen successfully. The top elected officials for Knox County and the city of Knoxville reacting to phase 2. The timing is an issue the two were originally split on.
My job, from where I sit, is to look at everything. That includes not only people's physical welfare and well-being and health and safety, but all the things that play into that. And one of those is our economic well-being, as well as our civil liberties and all those sort of things. And my position is one that all this, I have to be able to say, okay, this is all working correctly. So sometimes, I'm going to say, hey, this is out of whack, and we really need to consider with COVID-19 is what we're doing to mitigate COVID-19, is that going to have a long-term impact on the economic health of our community?
To me, our health, our personal physical health, is very much fundamental to our economic well-being. So we need to make sure that the community is healthy physically, emotionally, and that means we can then also have a healthy economy. I've spoken to lots of business people, and they want to make sure that we open up in a careful manner, because the worst thing that can happen to a business is to be shut down for a while and then reopen and then to be shut down again. So that's why being incremental and based on the data rather than ideology or politics. That's been my focus all the time, is just encouraging what Dr. Buchanan's role and is she's a medical doctor, they're public health professionals, to make the decisions based on science.
Yeah, we have some philosophical differences, but I understand her thought process, and she understands mine. And in the end, Mayor Kinccannon, she wants things to open up too, because the city of Knoxville is very dependent on the businesses in the city of Knoxville, and so is Knox County. I mean, like 68% of the cash registers in Knox County are within the city of Knoxville. So we've been able to work pretty well on all of this, actually. And yes, I might push a little further and she might push back, but in the end, we've been able to meet in the middle, and it's worked pretty well.
It's no surprise that Mayor Jacobs and I have different sort of political ideologies and ways of thinking about things, but I do for sure think that we both want what's best for the community, and I think that he also understands that our health is paramount, and that we need our employees to be healthy, and we need our businesses to be healthy. But for that to happen, what makes those businesses function is people, customers and employees. So in protecting our public health is really important to Mayor Jacobs and to me.
But both mayors agree data supports the next phase, opening more businesses and allowing people to gather in larger groups.
Our numbers are, as of now, they're great. And I think a lot of the reason for that is probably some good fortune. I think the health department has done a great job. I think our healthcare professionals have done a great job. But I also think the people in Knox County and East Tennessee have done a great job. And they've been responsible, and they've exercised that personal responsibility. And we have to do the same thing going forward. Unfortunately, COVID-19's it's not going to go away tomorrow. I wish it would, but it's going to be here, and we have to figure out a way to live with it, and we have to figure out a way to get back to normal as much as possible. And the way that we're going to do that is by making sure that it doesn't have a huge impact on our community, and all of us individually can help with that.
We are very fortunate. We have not been hit by this virus as hard as other communities. And I remember back in March when we were making very difficult decisions to shut things down, public health people said, if you do things right and you take immediate action early, people will say you overreacted. So I feel like taking early action and decisive action, even though it was painful, has helped save our community from the worst ravages of this virus. And so if we keep it up, we will continue to be, always dealing with it. The virus hasn't changed. The way it's transmitted hasn't changed. But we have been able to change our practices and have this new normal so we can mitigate the transmission, so our medical teams can handle the viruses when they do come, so our contact tracers can follow up and investigate.
Kinccannon and Jacobs both making a plea to the public to keep it up.
One of the things that I look at is, are we keeping it out of the vulnerable population with our hospitalizations and deaths? And that's happened very well as far as we look at that metric, and also the active cases now have dropped significantly. So I think that's something that's really surprised even me. So I'm just glad that we're able to move in the right direction, and that we are moving in the right direction.
The best in our community has come out. We've had some toxic conversations and some ugliness come out in this pandemic, but more often the case, I've seen people, whether they're at home, whether they're in their neighborhoods or in their workplaces, building bridges, feeling cooperative, learning what to do to protect themselves, their families, their employees, their customers. They want to do that. Whether, everybody wants to do that. And I feel that the more we can build those bridges, learn from each other, and work together, the more we're going to be able to thrive, even as we wait for a vaccine to have a more permanent solution to this. But in the meantime, building these bridges is going to really help.
And Dr. Martha Buchanan, director of the Knox County Health Department, saying the decision to advance to Phase 2 ahead of schedule was not due to pressure, but an evaluation of the situation as a whole.
This decision is being made including all of those pieces of information. The public health information, as we've been reporting, our data looks really good. We're really thrilled with that. We've heard from businesses, they're ready to open. We've heard from Mayor Jacobs and other elected officials. People just want to know when we're going to move forward. And our task force talked about it. It was a lively discussion, and they decided, we all decided together that we would move forward with that. We, as the public health official, we were comfortable with that change, and so that's what we're doing.
And looking a little further down the road, I also spoke to Mayor Jacobs about fall football and the potential economic impact the coronavirus could have on our region.
One of the concerns, though, still is the SEC decides to play ball, but you only get 10,000 people in Neyland Stadium. I mean, because no one's comfortable in going. And, of course, you can't control that. And if people aren't comfortable, you don't want them to go. And if there's a risk, you don't want them to go.
And a reminder, any decision about fall sports, well, that's made by the SEC. Still to come, a hot topic in Knoxville, police body cameras. Police Chief Eve Thomas answering questions about where the process of putting them in action stands. You're watching Tennessee This Week from WATE 6 on your side. We'll be right back.
Hello, I'm Mike Hatmaker. In the market for a right-handed Jeep, this is it. 2016 Jeep Wrangler Unlimited 4-wheel drive, right-handed drive, sale price $28,888. So hurry in now to Jim Carr Dodge Chrysler Jeep Ram.
When I became disabled, I lost my ability to work. It was then I knew I should have called the Garza Law Firm first.
At Garza Law Firm, we want to end your frustration and strengthen your claims so you can have the disability benefits that you need. The Garza Law Firm. Let us help.
Hello, I'm Mike Hatmaker. In the market for a right-handed Jeep, this is it. 2016 Jeep Wrangler Unlimited 4-wheel drive, right-handed drive, sale price $28,888. So hurry in now to Jim Carr Dodge Chrysler Jeep Ram.
I certainly never imagined that my genealogy hobby would lead to trying to crack cold cases.
We worked on it for 30 years. You solved that in 8 hours.
It actually took me 2.
The Genetic Detective premieres Tuesday on ABC.
Hey, welcome back to Tennessee This Week. Mayor Kincannon's budget includes nearly $750,000 to support body cameras and dash cams for all patrol officers. The process has been in the works for more than a year. Rolling the cameras out by the July 1st deadline, now looking unlikely. Chief Eve Thomas says a small part could be attributed to COVID-19 delays. She told our Madison Keevy this process takes time and delays are a sign they're trying to get it right.
You're seeing what Knoxville Police Chief Eve Thomas says is one of the benefits of body-worn cameras. One view limited to the dash of the cruiser, the other up close, together a full picture.
We want this. We probably want this more than the community.
This video, part of a test last year. The cameras worn by 2 officers for 90 days to get an idea of how the new technology could work for KPD.
How we have access to that video, how the cameras even turn on. I think one of the things we looked at was a door activated. So the officer opens their door and that body camera automatically comes on. So we don't have, you have to make a conscious effort to turn it off.
Saving and viewing any body camera video will likely be done on the cloud, automatically saved after it's recorded.
The data storage, being able to get to that video quickly. And again, we have to redact that. So, we have to be able to redact kids' faces by state law and some things out of that. So having software, that's some of the things we looked at, and software that allows us to redact within that software.
KPD's amount of data intake will double with the addition of around 300 body-worn cameras. They plan to hire an additional tech services position to fulfill public requests. That person, along with anyone using the new technology, will need training. So those delays, Thomas says, may likely have happened even without the pandemic.
I don't think it will happen by July 1st. That would probably be a near miracle at this point, but it is on track to move forward.
That was Madison Keevy reporting. Some of those pushing for body cameras say they're disappointed with the delay, calling it overdue even before the pandemic. Last August, activists marched after that officer-involved shooting death of Philly Feep. An investigation ruled the shooting justified. The officer was cleared in that case. One community activist tells us Feep's death is what inspired her to advocate for the body cams.
The least to say is that it's just a high disappointment, and as much as I felt like we had accomplished the mission of getting that rallied and that put to the forefront of attention, it seems like it's not, and we're going to have to bring it back to the attention of our council and our mayor to remind them, you made a commitment, you even had a deadline. Coronavirus is not an excuse to back out of the deadline.
That was Constance Every. She says she plans to attend city council meetings when restrictions on in-person gatherings due to COVID-19 are removed, willing to hold another march if the body cameras are delayed any further. The University of Tennessee's COVID-19 Task Force offering up best practices for bringing students back to campus. It's a work in progress, which could include schedule changes, faculty changes, and more facility changes and more testing.
It's a new normal. We got to get through this, and we need everybody working at it together. We're very interested in the idea around how we would use classrooms so that a third of the students come one day, a third the next, a third the next, and the other 2/3 are watching. We want students tested before they move into dorms. We want faculty, staff, and students to be tested somewhat regularly throughout the semester, working on those plans as well.
We asked about football, too. UT President Randy Boyd says no word on that decision yet as it comes from the CDC. Well, our panel of pundits is next. You're watching Tennessee This Week from WATE, 6 on your side.
You have a lot to take care of. Let us help you take care of your home. For a limited time, HEP Plumbing is offering half-price service fees. It's one way we can help you during this difficult time. HEP Plumbing, slashing fees to put your mind at ease.
Hello, my cat makers. In the market for a new Ram? This is it. 2019 Ram 1500 with Ram boxes. Sale price $24,888. 2019 Ram 1500 Crew Cab, $22,888 with lifetime warranty. New 2019 Ram 3500 Bighorn Crew Cab 4x4, $58,888 with lifetime warranty. 2019 Ram Quad Cab, sale price $25,888. Jim Caldwell's Chrysler Jeep Ram.
Drive forward. This isn't a small business opening. It's a reopening. Take 2. And just in time, because right now, people need coffee that tastes like coffee, and hair that doesn't look like that, and someone who knows where those numbers actually go. They need you, turning your community and the country around. One appointment, one customer, one thank you at a time. And to help you with that reopening, we're giving 1 free month of service when you switch to Spectrum Business. We're here for you because you're here for all of us.
You have a lot to take care of. Let us help you take care of your home. For a limited time, HEP Plumbing is offering half-price service fees. It's one way we can help you during this difficult time. HEP Plumbing, slashing fees to put your mind at ease.
All right, we've got our political analyst, George Corda, our healthcare expert, Craig Griffith, and our political contributor, Courtney Piper. All right, another week, guys. I want to start by just asking you guys about phase 2. We are just a couple days away here, and we've heard from lawmakers, we've heard from local leaders pushing that we step on the brakes, that we step on the gas. I'm just curious from you all, do you agree with how the reopening process has played out? Has it played out the right way? George, we'll start with you.
Who knows? I mean, seriously, I don't know. Nobody knows. This is an unprecedented situation. What we do know, and what I mentioned some weeks ago, and what Mayor Jacobs is saying, and what we talked about prior to the show here among ourselves, we have to figure out a way to live with this. We cannot destroy our economy and the world's economy by staying locked down for extended periods. Further, we just can't do it. Now, whether it's the right way or the wrong way, people are guessing. I mean, the CDC, Dr. Anthony Fauci, the World Health Organization have all had changes in direction through this pandemic, just in the last couple of months, changing what they say we ought to do, changing the level of the danger that it might be. So what they're doing is giving it, I think, their best guess based on, and that's what the local folks are doing too, the best guess based on past experience and what they think projecting forward might cause. And so do I hope it's the right thing to do? Yes. But one way or another, we've got to do something. We cannot go on living the way we have the last 2 months.
Greg, I want to ask if you agree with the way reopening is playing out, but you've made the point before that we have nothing to compare this to. What's done is done, and we have nothing to compare it to. So let you take a stab at that question.
Well, I think that the political leaders, both the mayors and Dr. Buchanan, are taking the best approach that they know to take. The old saying is that the only thing better than the current science is new science. And we're learning new science about this virus all the time, learning new ways to treat it, the new pathways that doctors are using to treat their patients. So I think we're learning more as we go down. The metrics that they've established seem to be working. The curve seems to have been flattened, at least in Knox County. We haven't had a tremendous number of new cases. So I think they're following their metrics, the best science that they know, and they can safely go to phase 2 now, I believe, and we'll have to see. It is a bit of a roll of the dice. No one knows. Will there be, because of the openings here and across the country, a more perilous second wave? You know, that remains to be seen.
Courtney, what do you make of the reopening process? Do you think it's playing out the right way?
Well, here's what I do know. Elected officials that are putting public pressure on public health officials to open up our economy at a faster pace simply because they're sick and tired of the way things are is not doing anything to inspire public trust and confidence in the phased reopening. When people like county mayors and state reps and state senators are writing to our public health officials and saying, you know what, I think we should accelerate phase 1 and get into phase 2 quicker, 2 days quicker. That's not doing anything to inspire the public trust and confidence that is required for people to actually participate in the economy. Our elected officials should let the public health officials do their jobs. And that's how we reopen in the best way, safest way possible, so people are actually participating in the economy.
Now, I think representatives and elected officials and county mayors have every right on the planet to say, I don't agree with how you're doing it. I don't think you're doing it right, or you're doing it right. I just think you should do it faster. They have that ability to do that as representatives of the people. And nobody, I think, suggests that, hey, what we ought to do is let the health authorities become dictatorial and tell us only what we can do and only when we can do it, because that's not right either.
Nobody's
you got to have a balance here.
I know, but for somebody who is, I don't know, an insurance salesman, challenging Dr. Martha Buchanan, who is a doctor and a public health expert, just seems a little asinine. There's one that has some background in public health and infectious disease, and another one that has absolutely no training or expertise in the subject matter.
Let me ask, does it make a difference? Dr. Buchanan made the comment this week in a news conference that this was based on data and lots of other things. So on that token, none of this feedback is really factored into her decision making. What do you guys think?
Well, I don't. She can read the tea leaves. She knows that there's being pressure put on her to come up with a decision that helps people get out. I mean, businesses are struggling. There is no question about that. Unemployment is up. You know, it's a very difficult stage for this country to go through. She understands that, but yet she still wants to put the best science forward that's going to help protect the most people. And there's still many bigger decisions down the road. How you open up schools, how you successfully open up the University of Tennessee again. So there are a number of big decisions down the road that will have to depend on the public health officials and experts in our community to get it right. Because nothing is worse than having to go through this again.
Well, but the chances of going through something again are high.
Right.
Because as you put more people back into the workplace, back into society, yeah, more people are going to catch it. But Knox County doesn't have to be treated the same way as New York or Detroit or one of those places. We got a very, very small number of COVID-19 cases here. Do we want to see it explode? No. But to go to your point, Courtney, I don't agree with that somebody who's elected to represent the people of Knox County has no business questioning the actions of the person who is in charge of the health department, because for the same reason, it is legitimate to look at the CDC, our elected officials, to look at the CDC or Dr. Fauci or the WHO and say, you know, you guys have missed this badly in some areas. And we're going to call you out on it rather than, okay, whatever you say goes whenever you say it, and we'll keep quiet. That's not their job.
Well, I also think we should take into consideration something that Dr. Buchanan did say this week. You know, if you see someone wearing a mask, don't berate them because they're wearing a mask. And if you see someone who's not wearing a mask, a face mask, don't berate them for not wearing a face mask. We need to come together in a plan that moves the community forward, gets it back open again in the safest manner possible.
I want to move on to body cameras, but really quickly to George and to Courtney, a quick yes or no. In our debate about whether public pressure was a good idea or not, do you think it tipped the scales for the health department's decision to enter phase 2 on Tuesday? George?
No way to know, but I wouldn't. I think if you say yes, then you're kind of denigrating Dr. Buchanan. If you say no, then she's not listening to the people who represent the residents of Knox County and the voters in Knox County. Do I think it sped her up? No. I think what's going on around the country, as the country is reopening, to sit here in a county with very few cases relatively and say, no, we're not going any faster than this, I think that's the pressure in itself.
And Craig said something about reading the tea leaves. Courtney, do you think this tipped the scales in any way, the public pressure?
I do, and I think it did tip the scales because we're opening 2 days early. I mean, what's with 2 days? What's the benefit of 2 days? It's 2 days.
Okay. All right. I want to move on to our next topic here, the topic of body cameras. Delays aside, will body cameras give the sort of answers people are hoping for? Courtney, I'll start with you on this question.
I think that the city of Knoxville is going through a really good process to get these body cameras. We all remember the hot mess that was the Tennessee TN Ready tests and how the vendor completely botched up that system, in addition to the fact that we don't have adequate broadband access across the state. And I think what Chief Thomas is doing with the rollout in terms of interviewing the vendors and making them come here to Knoxville so that we can actually test out the equipment and make sure it's capable of doing what we need it to do do is very smart. It will eliminate and troubleshoot on the front end a lot of the pitfalls that could make this rollout really clunky and awkward. So I think as they went through this, I know it's not as fast as some advocates would have liked to see, but I think as the city went through it, they realized that they wanted to get it right the first time, and there were a lot of other things for them to consider.
So George, they're on their way. Do you think they'll give the answers people are looking for?
Well, I agree with Courtney. I think there should have been body cams on the 10 ready tests. I think that we can agree on that. But you know, it's not like this is a new thing. Body cams have been around for a long time, and they should have been on the police officers before now. I think there needs to be a certain suggestion that there be some dispatch put to this decision, because it will indeed protect both the public and the police officers. And the longer it takes to get it done, the longer it takes before that happens.
Craig?
Well, I was with the city when we put the cameras in the cars, and it made a tremendous difference in community police relationships, because what was being seen on the tape. And now we're moving forward into this body cams. And I would venture that most police officers want to have these body cams as soon as possible before the next incident occurs. I think they've discovered that these body cams are their friends. Perhaps their only witness in a confrontational situation. So I'm assuming the police officers want it as fast as possible. And I would suggest that they move as fast as possible. But it's a very expensive process, and you also have to figure out how you're going to store the information, because it's going to be an expensive item to store these, and it's going to the cloud. You got to make sure your cloud's safe. A number of decisions that have to be made and that need to be made correctly on the front end.
All right, I've got about 30 seconds to give you all on this really big question here, perhaps the biggest topic we'll talk about for some. If the SEC says we will have a football season, what do you think it will look like, and how different is worth it? Courtney, I think I saw you nodding your head. What do you think?
Well, you know, it'll be interesting to see what they come up with. You know, NASCAR had a really interesting model, if it was last week, 2 weeks ago, where they did have a race. They didn't have spectators or tailgaters, but it was broadcast
it was last night.
Okay. Well, thank you, Craig. You know, I think that's a really good model to explore, but, you know, it's also going to be good to make this decision in concert with public health officials, so that we don't have an outbreak that's uncontrollable by jamming 120,000 people into a stadium.
All right, gentlemen, I got about 20 seconds each. George, what do you think?
I think, yeah, let them play and have some sort of lottery system where you let 30 or 40,000 people come into the stadium, space them out, but let there be spectators and let them play.
Let them play. Popular opinion there. All right, Craig, what do you think?
My prediction is that they'll start the season without anybody in the stands at all. It'll just be the games. They'll go for the TV money and wait farther down